Hello and welcome back to IB Psychology Revision. Today we are looking at syllabus point 5.9, which is discuss the use of eclectic approaches to treatment. So this syllabus point is not specific to any disorder, but refers generally to treatment of psychological disorders. As always, we want to look at the command term and keep that in mind as we're going through the content. So in this case, it's discuss, and in the IB world, that means offer a considered and balanced review that includes a range of arguments, factors, and/or hypotheses. Alright, so what we're going to do today is first look at a description of eclectic approaches, then look at the rationale for adopting such an approach, then some criticisms, some counter-criticisms, and a couple of research studies to include. Okay, so let's start with description. An eclectic approach is a combination of various psychological schools of thought. So you may have heard of different schools which may focus on behavior or cognition. And an eclectic approach is an integration of insight and action schools. So thinking about it and actually doing something about it. And it's what's known as a pragmatic approach, which means that the therapist can look at what works for the individual patient without having to adhere strictly to a specific set of guidelines. So what's good about an eclectic approach? The rationale for eclectic approaches is that we know that no one therapy has a 100% success rate. Therefore, no one therapy is necessarily superior over another, and it is often useful to combine the most appropriate and successful parts of different therapies tailored to the patient. Additionally, when we are treating psychological disorders, we don't want to be reductionist and only focus on one part of their well-being. So using an eclectic approach recognizes that a number of factors contribute to a patient's improvement, including support, insight, and action-based factors. Thirdly, many people recover without formal therapy, and so using this approach, we can use the natural healing systems within a client's environment because we have a little bit of room to be flexible. It also can reduce the cost and the length of a treatment, and there may not be trained therapists available in specific therapies, so having a therapist that can do a lot of things is more practical. A little bit of research. Hock estimates that about 40% of therapists adopt an eclectic approach. However, there have been some criticisms of this approach, and one of those is Lazarus. And he says that there's a real lack of rationale that determines how we're going to go about this treatment. There are no guidelines, and when there are no guidelines, how do we know that we are actually getting somewhere or that we're not just going around in circles? And he describes it as amounting to chaos. And there have been a couple of attempts to structure eclecticism a little bit, and one of those is technical eclecticism. So that's when a therapist works primarily within a specified framework, but imports other theories and approaches as they deem fit for the patient. Lazarus himself had a counter to his initial criticism, and that was using the basic IB approach, which recognizes a number of factors in the onset of a disorder or in the experience of a disorder, and that it this acronym BASIC IB is behavior, affective processes, sensations, images, cognitions, interpersonal relationships, and biological functions. So ideally in such a therapy you would be looking at all of those things rather than just focusing on one and missing out on a really crucial element. Thirdly, there's Shapiro's Scientist Practitioner approach, and this is also known as progressive hypothesizing. So when the patient first comes in, you make a hypothesis about what you want the treatment to look like, and then you monitor the progress as time goes on, and then you revisit your original hypothesis and see is it still applicable. And if it is, then you can continue. If it isn't, and then you can adjust the treatment accordingly. Lastly, we're just going to look at 2 additional studies to incorporate into your extended response. And the first one is Klerman. So Klerman was looking at whether medication alone or medication combined with psychotherapy, as in cognitive or behavior-based therapy, is more effective at preventing relapse. So he was looking specifically at neurotically depressed female patients, and these patients were given either tricyclic antidepressant or psychotherapy or a combination. So when they were given medication and a little bit of psychotherapy, they observed that there was a 12% relapse rate. And when they were given medication alone, it was observed that they had a 16% relapse rate. So there isn't a large difference, and although there have been multiple studies, multiple similar studies that show that a combination is better. However, it does show that a possible reason for this is that psychotherapy, unlike drug treatments, can aid with social adjustment and interpersonal relations. And this is supported by Rush's research, who concurs with Klerman in that drug treatment alone can have a higher relapse rate than CBT, as drugs cannot teach a person skills to cope with their disorder. So that's it for this syllabus point. See you next time.